Good morning or good afternoon, depending on where you are in the world. My name is Kayla Wade, and I would like to introduce you to my study on my research thesis titled The Interplay of Substance Use and Relationship Power Dynamics Among African American Women. My thesis mentor was Dr. Nina Harawa and Dr. Katrina Strode. To introduce you to our study, it's a secondary analysis based on the 2018 Females Project, which was basically a prevention, HIV, STD prevention intervention among African American low income women who reported sex with high risk men. We looked at the association between drug using behaviors of the study participants and their male partners, and to try to understand if relationship power played a role in how drug using behavior was affected. In order to measure the relationship power, we use Polarwitz Sexual Relationship Power Scale developed in 2000. It's a 23-item scale that measures relationship control and decision-making dominance based on Likert style fashion. Questions on this scale included examples as my partner controls what I wear, or my partner gets angry when asked to use a condom, and the participants would answer whether they strongly agree or disagree. In order to analyze these, we had to make eligibility criteria limited to the women who reported having a main partner and having any history of drug use from their partner and any current drug use within themselves. We base these categories based on no self-use among women or their partner, or partner use with one person using, and then the fourth was no self-use, no partner use. These categories were based on use of hard drugs, and then we examined the scores on the sexual relationship power scale using chi-square test and ANOVA. We predicted that women who reported use within themselves and in their partners would have the lowest level of relationship control. And so we did find out that within those groups, the 88 women who indicated no substance use in themselves or in their partner had the highest relationship scores in the relationship power scale. And the women who determined that they reported self-use and use in their partner had the lowest. There are a few limitations to this study. This was a self-administered survey, so we cannot completely predict that all responses are accurate. We also focus on a very distinct population of low-income African-American women within the Los Angeles area. So we do have to understand that these women may have faced other hardships that may have also impacted their levels of relationship control. In order to understand this relationship better, we think it's important to have a larger population size, as well as also look into how this scale can be useful within same gender relationships, because a lot of the questions were limited to heterosexual partnerships, and we think that relationship control and decision-making dominance should be measurable within all relationships. But in conclusion, we did find that low-income African-American women who report substance use in themselves and in their partners have less relationship control. And it's important to understand this relationship in order to help with intervention and prevention treatment options and better assist this population. Thank you for listening to my presentation.